The hepatic system consists of the liver and all functionally related structures. The liver is unique among the abdominal organs in having a dual blood supply, the hepatic artery and the portal vein. Terminal branches of these join to form common capillary beds. Thus, a mixture of venous and arterial blood bathes the liver cells, also known as hepatocytes. The functional units of the liver are cylindrical structures called lobules, of which there are approximately 50 to 100,000 in the liver. Each lobule is organized around a central vein that empties into the hepatic veins, and from there into the inferior vena cava, which is a large vein that brings blood from the lower half of the body to the heart. As blood travels through the liver, cells called Kupfer's cells remove waste products such as bacteria, old and defective blood cells, and other foreign material. The breakdown of defective red blood cells results in the formation of a pigment called bilirubin. The hepatocytes remove bilirubin from the blood and modify it so it can be secreted into adjacent small bile ducts called bile canaliculi. The bile canaliculi pass the bilirubin along to the common bile duct, where it is carried to the duodenum. At the duodenum, muscle tissue called the sphincter of Oddi regulates the flow of bile into the duodenum. When this sphincter is closed, bile moves back into the common duct and the gallbladder, where it is stored. The liver has three essential functions. Bile formation. Bile is formed in the hepatocytes. Bile is essential to the elimination of bilirubin because the bile transports the conjugated bilirubin. Once bile has been released into the duodenum, it aids in the digestion of dietary fats and fat-soluble vitamins. Glucose metabolism. The liver converts glucose into glycogen, which it stores in the hepatocytes. Subsequently, the glycogen is converted back to glucose and released as needed into the bloodstream to maintain normal levels of blood glucose. The liver can also synthesize additional glucose, a process called gluconeogenesis. Ammonia conversion. Gluconeogenesis results in the formation of ammonia as a byproduct. Ammonia is very toxic to body tissues, so the liver removes it from the blood quickly and converts it to urea, which is excreted by the kidneys. Intrahepatic biliary diseases disrupt the flow of bile through the liver, causing cholestasis, a stoppage or slowing of bile flow, and biliary cirrhosis. Bile is unable to drain from hepatocytes and enters the ductal system to drain into the duodenum. The liver attempts to repair itself by forming new bile roots. To accommodate the drainage of bile, the liver becomes enlarged. As the flow of bile continues to be impeded, the liver takes on a green hue due to bile buildup. Cirrhosis is the end stage of chronic liver disease, when much of the functional liver tissue has been replaced by fibrous tissue. Primary biliary cirrhosis involves inflammation and scarring of small intrahepatic bile ducts, portal inflammation, and the onset and progressive scarring and destruction of liver tissue. The liver becomes enlarged and takes on a green hue because of the accumulated bile. The cause of primary biliary cirrhosis is unclear, although an autoimmune mechanism is suspected. Secondary biliary cirrhosis results from prolonged obstruction of the extrabiliary tree, that is, stones in the gallbladder, leading to liver enlargement as bile accumulates due to the obstruction. Patients with secondary biliary cirrhosis may benefit from surgical procedures designed to relieve the obstruction. Alcohol-induced cirrhosis has three stages. Fatty liver disease is a condition characterized by triglyceride accumulation in the hepatocytes. The liver becomes yellow and enlarges owing to excessive fat accumulation. This stage of alcohol-induced cirrhosis is reversible once alcohol intake has stopped. Alcoholic hepatitis, the second stage, is characterized by the inflammation and necrosis of liver cells. This stage of the illness is sometimes reversible. Cirrhosis itself is the final, irreversible stage of alcoholic cirrhosis, in which dead liver cells are replaced by scar tissue, leading eventually to liver failure. Scarring continues, and the liver begins to shrink as fibrous tissue replaces normally functioning liver tissue. This leads to portal hypertension and liver failure. Portal hypertension is excessively high pressure in the portal vein, It develops when resistance to blood flow into or through the liver is increased because of fibrosis and scarring of the liver, for example, due to cirrhosis. Blood begins to back up, leading to venous dilation in the esophagus and the legs and even the rectum. At the same time, blood pressure increases in the portal venous system. Blood that normally enters the liver via the portal vein begins to bypass the liver, depriving the hepatocytes of their ability to perform essential functions. Ascites is the accumulation of fluid in the peritoneal cavity and is one major result of portal hypertension. The blood that bypasses the liver is diverted to abdominal peritoneal vessels. Due to increased capillary pressure, fluid leaks out and into the peritoneal cavity. In response, the body releases ADH, or antidiuretic hormone, and aldosterone. ADH conserves fluid by promoting reabsorption of water by the kidneys, and aldosterone works to increase the amount of sodium retained and thus increases water retention. Sodium and water retention increases, and fluid accumulation in the peritoneal cavity builds up even further. Often there are no symptoms of cirrhosis until the disease is far advanced. One symptom is nutritional deficiency. As the flow of bile into the duodenum decreases, the small intestine is less able to digest nutrients. Another symptom of cirrhosis is hepatocellular jaundice. Jaundice is a coloration of the skin, either yellow or greenish yellow, resulting from the abnormal elevation of the bilirubin concentration in the blood. Hepatocellular jaundice is the type of jaundice caused by the inability of damaged liver cells to clear normal amounts of bilirubin from the blood. Bilirubin also seeps into the person's urine, turning it pale and frothy, while the bilirubin level in stools is reduced. As a result, stools turn pale. Liver disease leads to the progressive scarring and destruction of liver tissue, the final stages of which are called cirrhosis. In cirrhosis, the flow of blood and bile is obstructed, leading to portal hypertension, resulting in ascites, nutritional deficiency, and hepatocellular jaundice.